Case Report Tips for the Novice Writer by Associate Professor Dr. Suraya Abdul Razak and Associate Professor Dr. Marymol Koshy, Faculty of Medicine, Universiti Teknologi Mara, Sungai Buloh Campus, Selangor, Malaysia. Conflict Disclosure Information. The presentation will be delivered by myself first, Suraya, then to be followed by Associate Professor Dr. Marymol Koshy. We, the presenters, have no personal or financial conflict of interest to declare. Introduction. For many medical doctors and academicians, a case report is the first step in getting an article published in medical journals. It is a very useful exercise in learning the art of writing scientifically due to the similarity of the basic methodology. Case reports are the lowest category in the world of evidence-based medicine, but can be powerful and instructional. This presentation aims to provide tips and guidelines to the novice writer to write a case report. Since the format for case reports vary for different journals, it is important that the authors read the target journal's instruction. When to publish a case report. Some of the reasons for publishing a case report include the following: a rare symptom or clinical condition of a disease, a unique feature or rare manifestation of a known disease, previously unreported disease or unrecognized disease, a new light on the pathogenesis of a disease, and unusual side effects to therapy or response to treatment, unique use of imaging modalities or diagnostic tests to assist in the diagnosis of a disease, or for medical education and audit. Structure of a case report. Different journals have different formats for case reports. In general, case reports should encompass the following. Number 1, abstract. Number 2, introduction with literature review. Number 3, description of the case. Number 4, discussion that includes a detailed explanation of the literature review. Number 5, conclusion. Some journals may require a separate literature review. Figures and images complement and enhance the case report. Title. The title is the first component of a case report that will be read by readers. It should be concise, informative, and relevant to the subject. The ideal title should attract the reader's attention and state the focus on a particular issue. Words such as unique case or first report of should be avoided. Abstract. Like other types of articles, it is necessary to include a short summary that gives an overall idea about the content of the case report. The abstract is a summary of the case, describe the uniqueness of the case, the problems, and the message to be conveyed. It typically has a word limit of 150 words or less, depending on the journal. The abstract should be unstructured, pose the clinical question or diagnostic problem, and provide essential information which allows for easier retrieval from electronic database and help researchers determine their levels of interest in the case report.
Introduction of the case report. The introduction of the case report is a brief overview of the uniqueness and problem of the case with relevant literature. It should be able to immediately attract the interest of the reader and thought of as a sales pitch for the rest of the manuscript. In the introduction section, the author should describe the background of the case, including the disorder, presentation of the case, and an explanation if it is a new disease. Progression of the case can also be briefly described here. Importance of the case report needs to be highlighted in relation to previous literature. Hence, a comprehensive literature review is needed to validate the author's claim in this section. A more detailed literature review should be done in the discussion or literature review section, depending on the journal's format. If it is a case report discussing an adverse drug interaction, it is in the introduction that the author should give details of the drug's common use and any previously reported side effects, along with a brief literature review. The introduction should be from the standpoint of a reader without specialist knowledge in the area, clearly explaining the background of the topic. The last paragraph should contain a brief statement of what is being reported in the manuscript. Case summary. The case summary is one of the most integral sections. In the case summary, all relevant details concerning the case should be written. It should contain only necessary information and nothing confusing or superfluous. The contents of this section should contain the following about the case. Number 1. Current medical condition. It is best to present the case in a chronological order. It can begin with the primary complaint, and the author should ensure that only pertinent information and details are included, leaving out unnecessary ones. Important negative findings should also be provided. Number 2. Past history. Here, aside from previous medical history, occupational and relevant social history, along with medications taken or allergies, can be included. Number 3, family history. Significant or relevant history must be stated. Number 4, physical examination results. The author can start with the vital signs presented at the examination. Number 5, investigation results such as laboratory tests and imaging. Pertinent investigations and results must be included. Here you can also include description of actual values for blood test results. Pathological specimens must have a detailed pathologist's report. Radiological images should be provided with a brief and clear description. Findings can be clearly and efficiently illustrated using pointers or markers. Number 6, differential diagnosis. Here, the relevant signs and symptoms that have resulted in the differential diagnosis must be described. It must include both the positive and negative to provide the readers with the context in which the authors have made their decisions. Number 7, management. A description of any treatment or intervention should be provided. Detailed dosages for medications prescribed can be mentioned here. Number 8, follow-up. Describe the clinical course during follow-up visits. This can also include intervention, modification, interruption, or discontinuation. It can include adverse effects or unanticipated events. Number 9, final diagnosis and actual outcome. Variables that made a difference with respect to the outcome of the situation must be highlighted. If it is a case series, then details of all patients must be included. The case summary should contain enough details for the reader to establish his or own conclusion about the validity of the case. Literature review. Depending on the journal's format, a separate section on literature review may be required. If a literature review section is required, it should be added before the discussion. The author should provide a summary of the existing literature available on the topic with references. Discussion. The discussion is the most important part of the case report that convinces the journal that the case is worthy of publication. The discussion summarizes the key findings of the case report and compares the case with what is already known in the literature and justifies its uniqueness, thus deriving new knowledge and its application to practice and clinical usefulness. In other words, why is the case notable? It should begin by expanding on the introduction and comparing the case with prior knowledge through published literature and highlighting how the present case differs from previously reported cases. In this section, the author can briefly summarize the published literature with contemporary references. The lessons that may be learnt from the case presented should be put forward, especially if it involves a new recommendation like management or using an imaging modality. Limitations of the case should also be stated. If tables or figures are presented, it should be revealed in chronological order. For surgical illustrations or images, a comprehensive summary of the surgical procedure must be provided. Don't use pictures without justification. Conclusion. This section depends on the journal's specified format. In most journals, case reports end with a conclusion or with summary points. They should be concise and brief with teaching points and clear take-home messages. It should state the conclusion of the case report and give an explanation of the importance and relevance of the case. The author is allowed to provide recommendations or suggestions to the clinicians or researchers. Some journals might not want a separate section for conclusion. In this case, a concluding paragraph can be part of the discussion section. Patient consent. Secure consent from the patient. Informed consent is an ethical requirement for case reports involving humans. Some journals might even require written consent from the patient at the time of submission. Parental consent is required in the case of a minor, and consent from a family member in the case of an adult who is unable to give consent. Patient anonymity is important, and remember not to disclose any information such as date of birth or hospital registration number that might expose the identity of the patient. Particular care must be taken with photographs, and identity must be erased from the images, such as radiological images. The following is a sample recommended to include in the case report. Written informed consent was obtained from the patient for publication of this case report and accompanied images. If the patient in the case report is unable to provide consent or is a minor, then the statement should be amended accordingly. Manuscripts may not be peer-reviewed if a statement of patient consent is not mentioned. Associate Professor Dr. Suraya and I would like to thank you for listening to our presentation and wish you all the best in writing your case report.